Today, we are beginning a serious and focused exploration into mental health. This is not for entertainment or inspiration. This is about understanding the reality of what mental illness is, how it affects the human mind, and whether spiritual insight has the potential to play a role in real, lasting healing. We are not approaching this as therapists or preachers, but as thinkers, examining both the clinical and spiritual dimensions of mental health with logic, precision, and responsibility. Mental illness, according to the DSM-5, is defined as a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. It reflects dysfunction in psychological, biological, or developmental processes. In other words, it is a disruption in the brain or emotional system that causes someone to think, feel, or act in ways that are not balanced, healthy, or sustainable. But beyond the clinical definition, we need to ask, what does this mean in plain terms? Mental illness is at its core a breakdown in the normal functioning of the mind. It represents a disconnect from peace, from stability, from self-control, and often from truth. It can be caused by trauma, stress, chemical imbalance, environment, identity confusion, or unresolved emotional wounds. These are not just theories. These are measurable and observable in both psychology and neurobiology. At the same time, there is a growing need to explore the spiritual component. Because in many cases, people are not just emotionally distressed or chemically imbalanced, they are disconnected from meaning, purpose, forgiveness, stillness, and truth. That disconnection creates symptoms. And if that's the case, then part of healing must involve more than just medication or coping tools. It must also involve reconnection to something deeper, something intelligent, moral, guiding, and grounding. So this is our mission, to evaluate mental illness from both angles, the clinical and the spiritual, the neurological and the moral, the observable dysfunction and the invisible disconnection. Our goal is not to discredit science, we are using it. But we're also investigating whether spiritual discipline, when properly understood and integrated, can be part of the solution. And finally, we're asking this central question. If one form of mental illness, like anxiety, can be alleviated through spiritual clarity and practices like mindfulness, prayer, solitude, and truth-telling, then what other forms can also be treated or supported in this way? Depression, trauma, addiction, obsessive behavior. Where is the line between disorder and disconnection? And can we help people cross it, not just to feel better, but to get better? In this series, we will examine each major category of mental illness one by one, not just to define it, but to understand it in full. We will explore its clinical characteristics, biological influences, psychological patterns, and most importantly, its spiritual dimensions. We're going to take our time. No rushing, no assumptions. Each subject will be handled with the depth and seriousness it deserves, starting with one of the most widespread and misunderstood conditions in the world, anxiety. In our next session, we will break down anxiety, what it is biologically, how it forms neurologically, and what it reveals spiritually. We will explore how anxiety can be both a survival mechanism and a sign of disconnection. And we'll ask the difficult but necessary question, can spiritual discipline restore what anxious thinking has disrupted? That's where we begin. Clear, grounded, structured. Anxiety, next.